Hello, I'm Dr Nick Penney, and if you're looking for some help to better understand your mind and how it influences your health and well-being, you've come to the right place. My clinical practice, Integrative Pain Care, is based in Auckland, New Zealand, and is where we help people of all ages understand what causes their pain and how our stress levels impact on our general health and well-being. More importantly, we give them the tools that they can use to take control and help them recover themselves. We're also very proud that we've just been awarded a contract to provide pain care services to the New Zealand Government's Accident Compensation Insurance Corporation. My doctoral work and research was done at the Centre for National Research on Disability and Rehabilitation Medicine at the Faculty of Medicine at the University of Queensland, leading to my Doctor of Philosophy in Musculoskeletal Medicine being awarded in 2009. My research centred on the reasons why we may not recover from back pain as quickly as we should, or not at all. A high proportion of people from all over the world suffering with low back pain still have symptoms after more than a year, and the reasons for this are not what you'd immediately think of. The influence of stress, distress, anxiety and depression, above all else, are by far the most common reasons why we don't recover from back pain as we might expect. These factors are also well known to play a role in a large number of other common health problems, such as chronic daily headaches or irritable bowel syndrome. This was one of the reasons why I started my own personal journey with mindfulness many years ago and started to research how it may help some of these patients who I could identify as not likely to be able to recover, particularly those suffering with chronic and persistent pain and general stress problems impacting negatively on their health and well-being. The research helps us understand how the mind-body interaction works and how we can learn to help ourselves through our programs of online training and education. My work guided the qualitative market research completed in Germany in the second half of 2016, which included general practitioners, medical specialists, and health insurers. We found that they broadly supported the introduction of our online mind training program for pain and everyday stress, and are highly likely to recommend it to their patients. A summary of these medical focus groups done in Germany is available on the website mindtraining.eu. I trained to teach mindfulness-based cognitive therapy with one of the world's leading researchers at the time and expert, Professor Mark Williams. Professor Williams at the time was head of the Oxford University Mindfulness Centre in the UK. In March 2015, an editorial in the Journal of the American Medical Association commented on a randomized controlled trial using mindfulness for chronic low back pain, which reported significant benefits for patients undergoing the training and with lasting positive effects. This editorial called for much better access to mind-body training, given its proven effectiveness. Another recent review was published in the Annals of the New York Academy of Sciences in 2016. It concluded that recent studies demonstrated that mindfulness practices significantly impact on pain through multiple and unique bodily and nervous system mechanisms, and it's an important consideration for the millions of chronic pain patients around the world seeking narcotic-free, self-facilitated pain therapy. As Professor Williams said some years ago, the discovery of mindfulness has been akin to discovering a whole new class of drugs that have no side effects. Do the training, learn the practices and techniques, and keep practicing. That literally is all that is needed. Another recent scientific study, a systematic review and meta-analysis of mindfulness, which is the strongest level of research we have in the scientific community, concluded that the evidence supports the use of mindfulness to alleviate symptoms, both mental and physical, in the adjunct treatment of chronic pain and associated mood disorders of stress, distress, anxiety and depression, amongst other medical conditions. Mindfulness was also reported to act as a preventative measure in healthy adults and children. So our online mindfulness training programs can not only help you get out of a difficult situation, but they may also help you flourish in your personal and professional life. In fact, many corporations around the world including Google and Apple, as well as some of the major banks and Big Four consulting accountancy firms, provide mindfulness training for their staff. Our comprehensive online course is suitable for all types of pain and stress-related conditions. There are 11 different modules which can be completed at your own pace and in your own time. They will give you the chance and opportunity to do this training for yourself and take control of your own health, impact positively on your own well-being, and help you cope far better with your pain and everyday stress. You can use and visit the individual modules as often as you like and as many times as you want. There are no time limits. Mindfulness mental training has been repeatedly shown in studies from around the world to help people cope better with the stresses of daily life and enjoy better physical and mental health. I integrate the best of this scientific evidence into my clinical work, and I'm happy that I can now share this with you in the online programs. I have never met anyone who's not benefited in some way from mindfulness training, and I'm sure you will also find it interesting and helpful now and in the future.